Hello, Vanakkam, and welcome back to the channel. Today's topic is selection of secondary diagnosis, and before that I want to take a moment to say a huge thank you for all the support you have shown in this channel lately. Your likes and comments really keep me motivated, and also I am planning to post 2 long form videos every month to cover these complex topics in depth. And if you find this video helpful, please like, share the video with your fellow coders, and also make sure you are subscribed and have notification on. And also, after today's SDX breakdown, our next topic is going to be ICD-10 PCS guidelines and route operation. So now let's get started. So coming to the first slide, which is definition for secondary diagnosis. So all conditions that coexist at the time of admission, that develop subsequently, or that affect the treatment received and or the length of stay. So now let's see this in a detailed manner. So chronic condition in the sense the condition that coexist at the time of admission. So like some kind of chronic conditions like diabetes mellitus, hypertension, and chronic kidney failure. These are the chronic conditions we have to report that as a SDX. And then some kind of complication that develop during the hospital stay, that also we need to report. And then some kind of history codes in the sense past medical history, surgical history, family history, allergy codes, and SDOH code, and acute condition that develops during the hospital stay. For example, hyponatremia, hypernatremia, UTA, and AFib. These are the conditions may develop during the hospital stay. Maybe after admission or at the time of admission, patient may have this kind of admission. So this also we need to report. And coming to the secondary diagnosis guideline, so for assigning SDX, we need to check for the 5 criteria. So which is clinical evaluation, diagnostic procedure, therapeutic treatment, extended length of stay, and increased nursing care. So for assigning SDX, we should validate whether the condition is evaluated, treated, or the particular condition increases the length of stay. So then only it is valid for assigning SDX. Now let's see about clinical evaluation. So for clinical evaluation, the doctor had to specifically examine or assess the condition. This includes getting a specialist opinion like consultation, or performing diagnostic tests like radiology or lab workup. For example, if a patient has cancer, an oncology consult count as a clinical evaluation. Coming to diagnostic procedure, the condition require extra tests or specialized procedures. For example, if a patient is suspected for having gastritis, so performing an EGD with biopsy satisfy this requirement. So this is comes under diagnostic procedures. So for therapeutic treatment, the patient receive actual medical intervention for the condition such as IV drops, tablets, or some kind of surgery. So let's see one example. If a patient has a seizure, receiving medications like Keppra, so this is a therapeutic treatment for the seizure. So for increased nursing care and monitoring, let's see one example. If the patient is placed in post-op recovery unit like recovery after surgery, as a principal example, after a procedure, patient are often placed in a specialized unit where the nurses can check their vital signs frequently. So coming to the 5th guideline, extended length of hospital stay. So mostly extended length of hospital stay is when it happens when a patient develop a new medical condition while they are already in a hospital. This new condition increases the total length of time. For example, developing an infection after a surgery may increases the length of stay in hospital. Now let's see one important guideline. So for chronic systemic conditions such as diabetes mellitus, CAD and hypertension, we can code this as a SDX. For chronic condition or acute condition, we have to look for the current treatment and extended length of stay, clinical evaluation, diagnostic workup, all the SDX guideline we have to check for. I will give one chronic systemic condition example. If the patient is admitted with myocardial infarction and the patient having past medical history of hypertension, we can code hypertension as a SDX for chronic condition alone. For example, if the patient is having a hip fracture, okay, then and he is having a hiatal hernia in the past medical history. So for that hernia, they have repaired or some surgery they were done previously. So at that time, we do not code that hiatal hernia as a SDX. So this is the criteria we should follow. So I will show one 3M example. So in this case, patient is admitted for hip fracture. So I have assigned PDX as hip fracture. So this patient has a past medical history of hypertension, hyperlipidemia, morbid obesity. So I have coded SDX as hypertension, hyperlipidemia and morbid obesity. So for morbid obesity, I have coded BMI also. And for fracture, we need to give the external cause codes, like how we should explain how the patient got the fracture. Like so here in this case, the patient is fall from chair. So I have coded fall from chair. And what kind of activity she is did at the time of fall. She is doing gardening. So at the time she fall from chair. So I have coded the place of occurrence and activity she done at the time of fracture. So this patient got divorced. So I have coded this SDOH code, that is disruption of family by separation and divorce. And this patient have a past surgical history of hysterectomy. So I have coded acquired absence of both cervix and uterus. And finally, the patient is taking long-term aspirin medication. So I have coded long-term use of aspirin. So this is how we need to report SDX. These are the condition, chronic condition and past medical history, surgical history, external cause. These are the things we need to report as a SDX. And thanks for watching.